Hi, I'm Dr. Ross.
And I'm Dr. Tiamno.
In this video, we're going to explain two main types of glaucoma: open-angle glaucoma and narrow-angle glaucoma.
In open-angle glaucoma, the fluid that's inside the eye doesn't drain out well. Think about a clog in the pipes under your sink. The fluid builds up and causes pressure inside the eye, and that pressure damages the optic nerve.
Even though the pressure builds up, you can't feel that extra pressure. But that extra pressure causes damage, and that's why glaucoma is called the sneak thief of sight, because you don't feel it happening. Glaucoma develops gradually, and usually by the time people are aware that they have it, they've lost their side vision, their peripheral vision, because the damage occurs to the optic nerve.
In narrow-angle glaucoma, also known as angle closure glaucoma, just as with open-angle glaucoma, the fluid inside the eye does not drain out very well. But in this type of glaucoma, the reason is different than in open angle. But the outcome ultimately is the same. The higher pressure damages the optic nerve, leading to vision loss. Angle closure glaucoma can occur suddenly or gradually.
It's common for people to confuse high blood pressure and high eye pressure. Hypertension is high blood pressure and is often called the silent killer because people who have high blood pressure don't feel it.
High blood pressure is different from someone who is high-strung or gets upset easily. Someone can be a very calm person but still have high blood pressure.
Glaucoma is called the sneak thief of sight. It's similar to high blood pressure, the silent killer, in that neither one has many symptoms, and those who have either one are not aware that they have it until it's too late.
Glaucoma is high eye pressure, which is the sneak thief of sight, and hypertension is high blood pressure, the silent killer. There's very little association between the two, meaning that just because someone has high blood pressure, it does not mean that they have high eye pressure or even the other way around. It's common to think that only older people get glaucoma, but in fact even younger people, and sometimes even babies and children, can have glaucoma.
It's common to think that if no one in your family has glaucoma, that you can't have it. That's simply not true. People can have high blood pressure or diabetes, even if no one in their family has. People can have high eye pressure, even if no one in the family has glaucoma.
It's true that people over the age of 60 are at greater risk of developing open-angle glaucoma compared to people in their 40s, but there are other types of glaucoma that can affect people aged 20 to 50 and even young infants.
Who's at a higher risk of developing glaucoma? African Americans and Hispanics, individuals with a family history of glaucoma, patients with heart disease and those with diabetes, and even people who are very nearsighted or myopic.
People who have previously had an eye injury or a blow to the head. People taking steroid medications over the long term. For example, people with asthma or other diseases that require taking steroids for a long period of time. The steroids that we're talking about here are not the type of steroids that your athletes might be taking. This is a different type of steroid.
The most common form of glaucoma is open-angle glaucoma. And it has almost no signs or symptoms until its very late stages, and by then you've already lost vision. High eye pressure doesn't cause any pain.
Glaucoma affects peripheral vision, or the side vision in the beginning, so it's hard to notice these changes until someone is further into the disease process. Nerve damage is permanent and impossible to regain again. The only way to detect glaucoma is to undergo a comprehensive eye exam and additional specialized testing.
But the good news is that we can treat glaucoma. We have many patients in our office that we treat for glaucoma. Similar to diabetes and high blood pressure, glaucoma is controlled. It's not cured.
The first-line treatment for glaucoma is an eye drop medication. At times, laser and surgical procedures are needed. These treatment options lower the pressure in the eye and reduce the risk for further damage to the optic nerve. The good news is that the tests for glaucoma are practically painless. In our office, we measure the visual field. This is how well you can see off to your side. This is your peripheral vision. You might think that you have good peripheral vision or side vision, but this special test measures it very accurately and helps us to identify if there are changes as early as possible.
Another special scan that we do in our office is called an OCT, or optical coherence tomography. It's like having an MRI, but don't worry, it's a lot faster and a lot less scary than an MRI. That test compares you to thousands of other people in the database and helps us determine how serious a condition you may have or may not have.
We will also measure the thickness of your cornea using a special instrument called a pachymeter. We test the drainage system inside your eye with a gonioscopy lens and an ultrasound that is similar to when a woman is pregnant.
We're fully equipped with the best equipment to determine if you have glaucoma and if you need to be treated. We treat conservatively, but we want to make sure that we're saving your vision from getting worse if in fact you do have glaucoma. Early detection is the best strategy. The good news is that you can prevent glaucoma by having a yearly eye examination. Early diagnosis, testing, and treatment can prevent the sight-threatening effects of glaucoma.
In our office, Family Eye Care in Old Bridge, testing for glaucoma is part of every examination, and this goes way beyond merely testing for eye pressure. We treat many patients who have glaucoma right here in our office.
We'd be happy to help you. Please consider calling our office to schedule for your comprehensive eye examination.